Now, a recent audit report by the Auditor General, which revealed a number of disturbing trends as far as menstrual hygiene is concerned in our country, has taken very many people by surprise and gotten several stakeholders talking about what they call period poverty and other menstrual hygiene challenges in our country. There's also another study which was conducted, which is known as the Menstrual Health and School Absenteeism among adolescent girls in Uganda, that also came out with very disturbing statistics. There's been a debate going on about provision of sexual and reproductive health services in schools, in spaces where the youth can go, but it seems we're making less progress there now. A group of women activists have chosen to focus on this particular issue as we commemorate the International Women's Day, which is due on Saturday next week. And today, our focus will be on that particular discussion as we try to understand what period poverty is and also the other menstruation health issues in our country. I have two people who are deeply engaged in this discussion. Let me introduce Ms. Rosette Nanyanzi, Gender Technical Advisor, Minister of Education and Sports. Good evening, Rosette. Thank you very much for joining us.
Good evening.
Also in studio, Ms. Julia Kemigisha, Legal Officer, Women Pro Bono Initiative. Good evening. Thank you very much for joining us.
Good evening.
All right, I'll begin with you, Julia. One of the reasons why I want to begin with you is because your organization is among those that issued a press release yesterday complaining about a number of issues linked to this audit report and the particular study which was conducted about absenteeism and adolescent girls in Uganda. What exactly is the picture? What got you looking at the Auditor General's report?
Thank you very much. So basically, when we saw this report, there were alarming issues raised, and you notice that this is just not a conversation that has started now. It has been there for a long time. I mean, since time immemorial, women have gone through menstruation, but it is now being a conversation that is being had on a national platform, and we feel like this is our opportunity to raise our voices for the girls and the women out there. So to paint a picture of what period poverty is and menstrual health and hygiene management, this is, it ranges from the access to products, the menstrual products that are used by girls. It ranges from that to the education about menstruation in schools and in communities. It also goes to the sanitation facilities that aid these girls to go through this process. So we are looking at, when you look at period poverty, this means the girls and the women are lacking access to those facilities, the sanitation facilities. They're lacking access to affordable menstrual products like pads and any other products that can be used. They are lacking also that education about how to manage, how to ensure that there is hygiene during your menstruation period. So the statistics that were brought out by the audit report, allow me to quote them verbatim. There was, they recorded 64% of girls missing school during their menstruation. They also talked about the 19.8% who missed at least one day during their last menstruation period. So when they asked these girls what the issue was and what the reason was behind their absenteeism, it was the major issue was that they could not be able to attend school normally and properly because they lacked these pads. They lacked the facilities to ensure them to be in school properly. So most of them would stay home because they have the fear of maybe wetting their dress, or the fear of being laughed at in class because your dress is stained and all of that. So it brought out a lot of things, especially from that challenge of being unable to access those products, and then also the stigma around it all, the way it is looked at as a taboo, and the way people don't usually want to bring it up as a topic because they feel like that is a woman's problem. But I feel like this is not only a woman's problem, it affects so much. as the government is trying to ensure that, girls are being brought up, how are they going to bring them up, or how are the girls actually going to meet those opportunities that they're being given if they are not even able to attain or complete their education? Because if we are to give a rough estimation, if I miss about 8 days monthly because I'm not able to go to school during my period, so that is like that's about a month I'm missing from school. So how am I going to be able to compete fairly? How am I going to be able to achieve my best goals in school? So it brings up more problems apart from just missing school, because now apart from affecting her right to education, there is also looking at their health. The report talked about how girls sit on halls, or they use used clothes and all of that. It was really devastating because it affects their health, yes. When they use those clothes that are dirty, when they use those any facilities that are not good for them, or they do not have access to water to actually wash up during that period. So it gives them complications, health complications.
I saw one report which even talked about sand. Use
of
sand.
The use of sand. They wrap a cloth around the sand and they use it. It's really devastating. And so there is that issue of also affecting their right to health and their dignity. Why should she be made to sit on a ground, on a hole, or use sand? Yet we can actually provide for them these products for them to use. We can provide for them clean water access. We can give them the education and tell them, listen, those clothes will make you sick. Make it a conversation in schools. So it ranges to so many rights of theirs that are affected.
All right. When you say that we need to provide, who exactly are we talking about here? Because we are talking about schools, but we're also talking about home where these children actually come from. So in your view, who is supposed to cover that gap?
Well, we look at the government. Why? Because these are vulnerable people. They may not, most of these people that actually need this are those people in those communities where they're not able to even afford. We know that most people live below the poverty line. So if they are not even able to attain basic needs like food and all that is being a problem, what about these menstrual products that are being priced highly, or the taxes that are being imposed? And so this is supposed to be something that the government should focus a part of their funding to, like the audit report talked about, the 0.05%. That is what is needed to cover the menstrual products for the girls in schools, out of the budget, 0.05. We looked at it as a very negligible fraction, because this is something that can actually be worked towards, and it can be implemented in the next budgets to come.
All right. We have heard from you. Let's hear from Rosette, who is from the Ministry of Education and Sports, where most times these girls that we are talking about stay as they continue with their learning. Your quick reaction when you saw this report, what came into your mind?
Actually, I just didn't see it. I was part of the process.
Okay.
Yeah, because the Auditor General, when they were starting the process, they had to contact us. They did a lot of reviews of the different documents, and we are part of this, and we are aware of what happened. And of course, when it came out, as a ministry, we had to give responses on what needs to be done to ensure that we address the different issues that are within our docket. Because when we talk about this subject of menstruation, it's not just an issue of the Ministry of Education alone. The child comes from a family to get to school. And according to the Education Act, there are roles and responsibilities of the different stakeholders in the education of the child. One of the roles of the parent is to ensure that this child of school-going age is enrolled. 2, ensuring that they provide the basic needs. And I would assume that a part is a basic need. And when this child comes to school, what are we doing as Ministry of Education? The first thing is to provide information. And I think before everyone got involved into this conversation, by 2013, the Ministry of Education had already developed a reader for this child who is about 8-9 years on understanding and managing menstruation. So that reader provides information on, first of all, on the body changes. What happens to the boys, what happens to the girls. Then we talk about menstruation. And then we talk about how do we manage? How do we manage? And then after that reader, in 2015, the Ministry of Education sent out a circular to all schools and institutions on ensuring that we provide emergency sanitary pads. And as we talk right now, these are being provided. But like I've said, this is a big issue, cannot only be handled by the Ministry of Education. You talked about each girl getting a pad. We appreciate that women are not homogeneous, we are not the same. I may be able to use one pad, but somebody else uses 3 packets. And we know that with that, it may not be sustainable. 2, every day there is a girl that starts menstruation. So even when you say that it is 0.5% of the education budget, it may not be enough. So as we are talking about how do we go about this, the Ministry of Education is ensuring that at least we provide the emergency in case you came and you're not prepared, but the parent has a critical role to play to ensure that this child actually goes through this stage with dignity. So that is what is happening.
All right. When you say that you're providing emergency, one would be surprised to hear that, because there are so many schools in this country. What is the reach? Are you able to provide in all schools?
The circular that went out was to all institutions, to all institutions, to provide emergency sanitary pads. And actually part of the capitation grant goes on that. But we also appreciate that we have different managers out there. The school managers, they may not see this as a priority, and maybe where the Auditor General went, maybe they were not able to find these provisions, but the circular went to all schools and institutions to ensure that schools are able to put in place emergency sanitary pads. In case you came and you're not prepared, you can be able to get to the senior woman teacher, you get the provisions, and when you go back home, then you'll be able to receive from your parents. But that aside, there have been some efforts by the government of Uganda, and specifically Ministry of Education, to look at the most vulnerable girls. Since 2022, we've been working with the Global Fund, and we've been working in a number of districts to make sure that those most vulnerable girls are able to have these provisions. And this is a program that is still ongoing in a number of districts across the country.
All right. Now, you've had a response from the Ministry of Education and Sports, which is one of the key stakeholders when we talk about menstrual hygiene in our country. They're already responding to this situation. Does this make you happy? Do you still think there are certain things that they need to deal with in order to respond to the challenge at hand?
Okay. Yes, we do indeed acknowledge that steps are being taken. But by virtue of the fact that these statistics and these issues are still prevailing, that actually tries to inform us that you need to maybe re-strategize. You need to re-strategize the actions that you're taking, because perhaps they are not being able to reach a certain number of people or a certain group of people. You may talk about that it is being maybe implemented.
Let us say which was issued.
It's being implemented in schools. Let us say this education is being implemented in schools. But what about what is the enforcement guarantee that we can get? Because if you look, perhaps it is being taken up by these urban schools. You find most the schools in the urban centers, the town centers, are the ones that actually be informed about this. But what about now those grassroots communities? Those are the ones who are still digging the holes. Those are the ones who are still using the sand, according to the report, as you saw where it was held, the region in which they reached out to. So, despite that, we feel like perhaps there is need to re-strategize those actions that are being taken, and also trying to involve private stakeholders, because these other organizations, the civic space organizations, have been trying to fill in the gap that has been, that has been there. They try to fill in the gap. You find those that are providing sanitary towels. You find those that are advocating for it to happen, or that are informing the public to make it a concern of the community. So I think there is need to try to work collectively with those organizations in order to achieve the desired goal, because at the end of the day, the most important thing is to ensure that these girls actually do have access. Then the issue of the parent is supposed to provide it as a basic need. Yes, we understand that. But what about those people who the government swore when they came into power? They say that they're going to uphold the constitution, and the constitution gives these people their right to health, the right to access these services. So if they are not able to, you cannot sit back and leave it to them to do. You need to step in as the government. You need to step in as the people in charge and ensure that these services that you're saying you're going to uphold, that are actually reaching the people that they are meant to reach.
All right. Let me ask you if you can give us a typical example as far as menstrual hygiene is concerned. What would you like to see in a school environment? Tell us, what is supposed to be there?
Okay, in a school environment, for menstruation? Menstrual hygiene, sorry. So there should be a facility for the girls. Yeah, a private facility for the girls.
Room.
Yes, we are not saying let it be a luxury room and all that, but we are saying the basic requirements should be there. Is there access to water?
It should be completely separate from the sick bay, something like that?
Yes, it should be separate from the boys' facilities, for example. It should have where to dispose properly their sanitary towels, because that's also an issue that will later contribute to maybe climate issues and all of that. So is there a way for them to have proper sanitation water, to have where to dispose them, and also if they can have a provision for emergency in case someone was not able to carry one or could not afford one, can they pick one from the facilities that are there in the washrooms, or maybe the sick bay? Of course, it's not given that not all schools can meet the same standard, but you can fit within the means that you have to provide something that will be able to help them.
All right. Rosette, when you move to different parts of this country, you'll sometimes find schools whose structures are dilapidated. Now we are talking about a situation where you need a room, to cater for menstrual hygiene. You need to have sanitary pads there, but also we need to have access to clean and safe water, and also conducive environment that will allow the girls to actually stay in school. Are we likely to provide this, looking at the way things are?
Yes, and this is something that government of Uganda has already embarked on. For instance, we have revised our construction designs to take into consideration the unique needs of these adolescent girls as they go through menstruation. So provisions of a changing room, provisions of an incinerator, a washroom, as well as ensuring that all the schools that we are constructing having these provisions. For instance, right now there are ongoing projects in the Ministry of Education. We are going to expand secondary schools, and under that we are about to construct about 170 schools, and under those schools we'll be able to put those provisions. We have another program, Gender for Development, which is also constructing in about 200 schools. So there is some ongoing work. But like we've said that the issues are huge. And from her submissions, you would see that this is not something that can be done by the Ministry of Education alone. For instance, sitting on the stones. These are some of the social norms. And there is a ministry directly responsible for community engagement, addressing social norms. That's the Ministry of Gender, Labour and Social Development. But that aside, when you don't have what to use, you're likely to get UTIs. So how does Ministry of Health get into this conversation? So it's not a conversation that is just looking at sanitary pads. It has to go beyond. We should be able to look at it holistically. If this girl is menstruating every month, they need to have nutritious food. Therefore, the Ministry of Agriculture gets involved into this. So as Ministry of Education, we are doing what is within our mandate, but the issue is more than what we think. For instance, issues of disposal. Can we engage with NEMA? How do we dispose of these things? If we are talking about, mental health, because that is also another emerging issue, that when you don't have or you're not sure of what to use, you're likely to get into depression. So Ministry of Health should be able to come in. So it is, if we have to look at it, we need to look at it holistically so that it's not just a conversation that is being pushed by Ministry of Education alone, but the other actors need to get on board.
Well, you talked about the Minister of Health, you talked about Minister of Gender, Labour and Social Development, and one would think that within a school environment, those particular sectors are provided for. For instance, we hear each school must have a health facility, somebody to take care of the health of the children. Earlier on, I mentioned the sick bay. I don't know if all government schools do have those facilities. You're also supposed to have a senior woman teacher who is also supposed to play that role of Minister of Gender, Labour and Social Development. Are you suggesting that in some schools they're missing?
Yeah, we appreciate, and that multi-sectoral working is not just at the local level. At the national level, we have a national steering committee, and we have also the Menstrual Health Coalition, where we bring in partners, different members of the civil society, to be able to work together with us to make sure that we push this. When we go to the community level, we have parasocial workers, we have BHTs. I think that's where we have gaps. As we talk about these services that need to be provided, can I see a parasocial worker when they are doing their roles in the community to be able to sensitize parents of their roles and responsibilities to ensure that they can provide these requirements to the girls as they go through menstruation? Can I see the role of the VHT strengthened to be able to tell the different family that in case this child has maybe she's experiencing cramps, over bleeding, can they be able to be linked to the different services? At the school level, together with the Ministry of Health, we are exploring establishing a referral and linkage system so that those cases that we cannot handle as education, for instance, if you overuse the pad, you're likely to get a UTI. Can we see the health workers coming into our schools to be able to speak about these issues? Some of the schools we acknowledge do not even have the nurses. In some schools, we don't have sick bays. So if those are not there, then these other local structures like the VHT, the parasocial workers should be able to address these issues.
All right. Spectrum on Radio 1 FM 90. Our topic of discussion today, understanding period poverty and other menstrual hygiene challenges in Uganda. My guest, Ms. Rosette Nanyazi, Gender Technical Advisor, Minister of Education and Sports, Ms. Julia Kemigisha, Legal Officer, Women Pro Bono Initiative. We're going to go for a break now, but keep your comments coming via the WhatsApp line 0703 090 090. Spectrum continues after this break. Thank you so much for staying with us on Spectrum, live on Radio 1 FM 90. My name is Kenneth Anderson Lukwago, your host. My guest this evening, Ms. Rosette Nanyazi, Gender Technical Advisor, Minister of Education and Sports, Ms. Julia Kemigisha, Legal Officer, Women Pro Bono Initiative. Our topic of discussion rotates around period poverty and other menstrual hygiene challenges in Uganda, and this is prompted by this ongoing discussion about an audit report by the Auditor General, which actually indicates that lack of menstrual hygiene products for girls in this country is leading to 64% of girls missing school days, and this exposes a crisis that demands immediate attention. Several organizations that are working around this particular area, including Women Pro Bono Initiative, did raise concerns about this kind of situation, and we're trying to see what actually needs to be done to be able to fix the gap, because if girls are missing school, it means a certain generation is actually going to be left behind. Well, as we carry out this discussion, one of the biggest elephant in the room to be able to meet these particular demands that you're making is, for instance, having adequate supply of cheap sanitary products. We are told if taxes were reduced on some of these products, maybe they would become cheaper for parents to be able to afford them, or for schools to buy them in large quantities. We are told there is no adequate funding to be able to cater for everything. The government is facing a lot of pressure, and they will tell you there are other equally important priorities that actually need to be addressed. There's also been a discussion about setting up industries here, and also the issue of reusable sanitary pads. And I'll begin with you, Kemigisha. Your quick response to some of these issues. What do you think needs to be done? Because we are talking about a need to supply. Rosette tells you that as we talk now, a number of girls are beginning their menstrual cycle, and therefore the number keeps on increasing every day.
Okay. So first of all, there needs to be domestic financing for an uninterrupted access to these products. So there needs to be a comprehensive plan in place to address the funding gaps. We cannot keep relying on financial constraints without actually having a plan and a strategy in place. She mentioned earlier that the 0.05 may not be enough of the budget to answer all these problems, but let it first be there in the first place for us to actually start to have a starting point from. So if we can address, if we can actually have an answer to that, to what plan do you have in place when you say that the funding is not enough, yet there are other, I'm sure that the budget can be, this is something that can be included in the budget, because there are so many other things that are catered for that can be subsidized to include this, that is something that is pertinent to the right of health for our young girls and the women in Uganda.
All right, Rosette, would you like to respond to that particular question that I put to Kemigisha? Amidst all this demand, you did indicate that after receiving this report, you provided some answers to the Auditor General about what needs to be done. From the Ministry of Education and Sports, what were your quick recommendations having seen this report?
Yeah, thank you very much. First of all, I want to acknowledge the issues that are coming through, but the Ministry of Education is not sitting. We have embarked, and actually the strategic plan is in its final stages of approval to make sure that some of the challenges that we have can be addressed. But that aside, when you look at the education budget and how much is spent on construction, is actually trying to address issues of menstrual health. What is not coming through is the real money for a pad. And that is where I said that as Ministry of Education is providing the emergencies, and as we think about homemade solutions, can we have the role of parenting emphasized so that parents are not just saying this is government, because government is looking at so many things. But if parents can also be able to support, as Ministry of Education is trying to mobilize resources for construction of wash facilities, for building the capacity of the teachers to be able to support the learners, or for ensuring that we create a safe environment, then the parent needs also to come in and be able to contribute. But when it comes to the issue of taxation. I'm glad to inform you that of recent, Parliament of Uganda has actually established an MHM forum so that we can be able to discuss issues of taxation on these products, and we are looking forward to that forum being able to support us to ensure that there is a reduction on pads, taxes on pads, and then every Ugandan can be able to achieve and get them. I think that is what I had to respond on that.
Well, you want to come in? Yes, Julia.
On the issue of taxes that I had not commented on earlier, yes, she has spoken about how they are trying to implement a strategy that the pads are tax exempt and they are able to be affordable. But allow me to also bring out that issue of the adult diapers, the tax that was implemented with the adult diapers. Actually, Women's Pro Bono Initiative instituted a case against government concerning this very issue. When they put these taxes on the adult diapers, there was not enough research made to acknowledge the fact that this tax is making these diapers very expensive. And these diapers are being used by also women during menstruation, especially those who have fistula, those who grow up with that disease. It's called spina bifida. It's a lifelong disease. It starts with a child and they go through it, and they are not able to control their bowel movement and any other thing that may flow. So when these diapers are that expensive and these people are already disabled and they are already facing these health challenges, what exactly do we want them, how do we want them to survive, how do we want them to realize their health if these taxes continue to be an issue for them? So that is something that needs to be answered to. That's something that needs to be revisited, especially because you're not only affecting the girls and the women, but you're also affecting the disabled community.
All right.
Yeah.
All right. Rosette, one particular issue that I remember vividly about the issue of sanitary pad was a promise which was made by the Minister of Education and Sports, Janet Kataha Museveni. So some people still use that and say, look, there was a pledge by the ministry to be able to provide these sanitary pads. And maybe that's why people like Kemi Gisha still insist that the government has a role to play. What happened to that pledge?
Yeah.
Has it gone silent, or there's something being done about it?
The pledge has not gone silent. And the Minister of Education has been looking around for the different resources to ensure that this is done. But we have explored a number of options, and I think the best option that would have as a country is to have our own production units. So when we presented to Parliament our request, I think that was in 2018, Parliament guided that with the minimal resources at hand, we should start looking at the hardware first, so that by the time we get to that point of having our production unit, at least the hardware is in place. We are still pushing for that. And I know that it will come to reality in the near future. But for now, we are improving the infrastructure. We are ensuring that we put water. We are ensuring that we provide information. But also, as government of Uganda, we are running a life skills program, which is empowering these young people to be able to manage the different challenges that come with growth and maturation, and menstruation is one of them. Under that component, there is a skilling program that if I cannot afford a pad from the market, I can be able to make my own pad. Because
is that the reusable ones?
Those are the reusable ones.
There's another debate
But
around that
there is also I know the debate that as we're talking about reusable, then issues of water come in, aware that some regions don't have enough water, but also how do we sustainably use the water that we have? So there are so many opportunities that are coming, there are products that are coming on the market that would be able to address that, but Uganda has not yet reached that level. So as we struggle and do research on a number of areas, we should at least be able to use what is available for now. I wanted to say something about the discussions about the taxation on pads and adult diapers. I think what we need to do more as stakeholders, we need to, the parliamentary forum is an opportunity for us. That parliamentary forum on menstrual health is an opportunity for us. So what we need to do as partners, can we try to create awareness about these issues with members of parliament? Because I don't think they would have passed a tax on diapers if we had educated them about the different people that are affected. So we need to do a lot of awareness to our members of parliament. And as we celebrate the International Women's Day, we need to repurpose how we engage. We need to see these female members of parliament as our allies, so that we provide them with information so that they can be able to push for the agenda to reduce on taxation on products that affect women's menstrual health.
All right. You wanted to chip in on the issue of reusable sanitary pads. You heard Rosette actually saying they can skill the girls to be able to make their own pads, but there's always been a debate around that issue of reusable. Are you in support or you're opposed to those particular pads?
Of course, it's we're in support of these reusable pads because they are skilling these girls to be able to, they are empowering them. Because where they stand, they seem a bit hopeless because there are so many efforts, there are so many promises, but nothing actually reaches to some of them or most of them. So we have to equip them to be ready to adapt, to be able to adapt and be able to make these products for themselves. So, however, there is a bit of negativity towards it, looking at it as a bad, from a bad perspective. But we need to realize that when someone does not have the means, they need to be able to adapt and be able to be taught how to survive with what they have. So this empowering them to make their own pads is actually a good initiative. Yes.
All right. We have a number of comments coming in from the listeners. I'm going to read some of the comments and then you respond to them. We have a comment here coming from Robert, who is listening in from Yombe district, and he says, thank you for the program. What I can tell you is that the government has failed almost in all sectors. Now for us, we resorted to lobbying funds to purchase the pads for the girls at Otumbari Primary School in Terego district. We have another comment here. Menstrual hygiene and missing school. Miss Julian, working for the women rights, is so articulate. 0.05% of the budget is too small as compared to useless expenditures by the government, especially the political donations and money spent on RDCs and NRM cadres. On the other hand, Rossetti from Ministry of Education and Sport is so economical with the truth. Kenneth, the capitation grant that she's talking about, just a second. The capitation grant she's talking about, one, remember, the government gives only 10K for a UPE pupil for a whole year. Two, the policy she's talking about is only on paper, and without emphasizing on practical provided services. Then we have another comment. He says, lastly, let Rosette not be diversionary. For start, let's focus on the provision of those services at school, with one of the main goals to keep the girl child in school learning, bearing in mind that a majority of our population in Uganda is swimming in poverty. Finally, one of the campaigns, President Museveni and his wife promised to provide pads for all school-going girls in Uganda. Where are they? Then we have another comment. The pad issue doesn't stop in school. Many women outside school can't afford them as well. They have fallen to sex predators who lure them into doing bad things. The Minister of Gender, Labor and Social Development should come up strongly to solve this. What standards do you follow when licensing schools? Health and safety should have been key, but I'm shocked that you admit you admit some schools don't have health personnel. That's Patrick listening in from Masindi. Well, those are some of the comments that are coming in. We have another one from Susan, who says, beyond hardware and infrastructure, how is the Ministry of Education preparing schools to provide appropriate menstrual hygiene, health, and information, including for prevention or stigma? She also says, I would like to hear more also about the social norms aspect. Well, those are some of the comments that we have got from the listeners. If we can quickly respond to them, and I want to begin with you, Rosette, because most of them were actually directed towards you.
Yeah, thank you very much. I think I'll start with the last ones. What are we doing to provide beyond menstruation? Talk about menstruation, sexual reproductive health. You are all aware that Ministry of Education developed a sexuality education framework. That framework is under review currently, but we also have programs that are running. We have a life skills toolkit that we are rolling out to all schools to make sure that young people can be able to get information they need. On the issue of social norms, there are so many things that come when a girl starts menstruation. For instance, in most communities, they will say, you are now a woman. And what does that mean? That you can get married, you can, leave school. So as we talk about this subject, we always emphasize those social norms. But there are also other things they say. When you're menstruating, don't go to the garden, don't cross a junction. So if you're supposed to go to school, will you go to school that day when you're menstruating? So as we are engaging on this conversation, we need to engage more to be able to address those negative social norms. Somebody talked about the campaign and provision of sanitary pads, and I
the
think
promise by the First Lady and the President.
Yes, and I've already shared that part of the initiatives that we are doing, we are providing emergency, but we have also mobilized resources, and we are looking at the most vulnerable girls. And this program has been running for the last 4 years, and I think right now we have reached over 40,000 girls. These are given pads on a timely basis in selected districts across the country. How do we select these girls? The school community chooses the girls that will be benefiting. And we've been doing this since 2021 in a number of districts. You talked about the policy being on the paper. How does the policy get to the different stakeholders? We have different mandates, and we have where to stop. At the national level, we developed the policies. We disseminate them to the districts. And we expect the district local governments to be able to take this information to that lowest person within the district. So we appreciate there are gaps there where information reaches the district and it remains there, and we hope to do more to make sure that we improve that.
All right. Very quickly, Julia, quick response to some of the questions that have been put across, but also you can tell us your recommendations or give us also your closing remarks, because we're also coming to the end of this show.
All right. Thank you very much. So first of all, most of the concerns that are being raised are exactly what most of what we are actually trying to voice out. And I'm glad that it's coming from the people themselves, because as we keep on, especially the issue of hearing, you keep on hearing promises are made, but we not actually get to the realization of those promises. That is why I feel like the International Women's Day theme said accelerating action. I think we need to go beyond just saying this is going to be done or this is going to be done, because we are used to those promises not being fulfilled. So do we have an actual concrete plan? Because the government usually makes plans and they say maybe by 2020, by 2030 this will be done, by 2045 this will be done. They have those goals. So can we also see such a comprehensive plan, especially towards the funding and the gaps that are there? And then also she talked about the construction that is ongoing and the efforts in the building facilities and all of that. But the very funds that are doing those construction and the what and all of that, and we keep on saying, the promises that were made by the First Lady during or the
campaigns.
President, yes, during the campaigns up to this day. what has been done. If they have already allocated a bit of money for construction and all of that, why weren't some of those funds also allocated to cater at least for that as they keep pushing? Because I feel like we cannot attack this situation. We may build the facilities, yes, but if the girl has, if she cannot access something to use, then it becomes futile. The efforts become futile. And then also the issue of, yes, we say that the Ministry of Education is not alone in this. Everyone has to come on board. But you alone, you need to make your stamp and your mark. For example, when you see policies that come in that are affecting these rights, you need to be able to speak up and collectively come together with other organizations and face them head on and tell them this policy that you have put in place is not going to help us to achieve our desired goals according to the plans and strategies that we have. And also there's a person who commented about the schools deep down, like I had already mentioned earlier. Yes, the policies or this education is trying to be implemented, but how are we going to be able to break the down communities, those ones that are still upholding those social norms that say a girl at menstruation, you're now going into marriage? Then that it exacerbates into another issue of teenage pregnancies, of early marriages. So, and to me, I feel like education is very important in this conversation because it forms children. What you learn from when you're young usually propels you into your future. Exactly. So the curriculum, the way of life, everything that is given at this vital stage of education, I feel like it plays a very big role. Of course, other ministries, other stakeholders have to go on board with this plan. It needs to be a united effort, but that effort includes calling out those ministries that are not doing their part of their end of the bargain, and also then I would also like to comment lastly on an issue when she said that when this policy of the tax came into place, we had the people that put this into place had not got the information. But we know that before an act or before a bill is brought and tabled, there needs to be research made. So what research was exactly based on to make these amendments that were taxing diapers? What did they base on? The onus is not on us to tell you. The onus is on you to make the research and find out and see how are these policies going to affect these people. Remember, you are leaders. We look up to you. And everything begins from you. You know, you set the pace, you set the ground. So you need to this research needed to have been made before even these policies came into play.
All right. We have a comment coming in. Very quickly. Lastly, basically, I think that let us hold hands and also support these organizations that were standing in the gap. The shrinking civil space became a problem because these organizations that were helping, their funding was cut. So now how are they going to be able to stand in the gap that has been created? Yes. All right. We have a comment from Elliot, who is listening in from Pereira, who said, I want to appreciate the Ministry of Education and Sports, especially Rosette, who has been prominent in partnering with NGOs in the menstrual health sector like iRise Institute East Africa. I don't agree with the listener who said the policy is on paper. Many people are just not informed that this policy is being implemented through concerted efforts. Your closing remarks, Rosette, as we come to the end of this show.
Yeah, thank you very much for this conversation. I think for me, as I conclude, menstruation is everyone's business. So whoever has to play the business, the civil society, government ministries, parliament, let's all join our hands to make sure that it's not just the Ministry of Education, but all of us. Thank you.
All right. And your final closing remarks as we come to the end of the show?
As we come to the end of the show, I just speak from a place of all the girls and women, and I know that my co-speaker here also speaks from that place, because this is something that cannot be dealt away with. So when you hear those voices crying out and all those people who are telling you, what are we going to do, how are we going to solve this, where do they want us to begin from? Those are the voices, and that's the pain that we try to project and try to bring out so that we can get an answer. However, as she said, we do need to hold hands.
Alright.
But in our roles, let us do our best. Let
Alright.
us do our best.
All right, with that, we come to the end of Spectrum. Let me thank you, dear guests, for making time to actually come here for this particular discussion, and we hope something will be done about this challenge of menstrual hygiene in our country. Tomorrow, 2 hours of analysis of the top events of the week, but right now,